أعلن افتتاح الجلسة. صباح الخير سيداتي وسادتي. أبلغتني الأمانة بتلقي أوراق اعتماد رسمية منذ انعقاد جلسة يوم الأربعاء من الأردن وفلسطين اللتين سبق أن قدمتا أوراق اعتماد مؤقتة.
Good morning, ladies and gentlemen. I declare open the Assembly. I was informed by the Secretariat that the credentials of two countries, so Jordan and Kyrgyzstan, have been presented, and as has been set out in the first report of the Committee on Credentials, so according to practice, I have examined these credentials and I find them to be in compliance with the rules of procedure of the Assembly. Therefore, I recommend that the Assembly accepts the credentials of Jordan and Kyrgyzstan officially. Does the Assembly agree with this proposal? I see no objection, so it is so decided. We shall now proceed with item 7 of the agenda, awards. Excellencies, ladies and gentlemen, we are assembled here today for the presentation of prizes awarded to institutions or individuals that have, for astounding achievements in general health development. Please refer to document A69 Inf 1 Awards, which contains more information on this year's awardees. It is my pleasure to announce that the 2016 Ihsan Dogramji Family Health Foundation Prize has been awarded to Professor Sir Michael Marmot of the United Kingdom of Great Britain and Northern Ireland. I invite Professor Ali Dogramachi, President of Bilkent University, to address the Assembly on behalf of the Ihsan Dogramachi Family Health Foundation. Sir, you have the floor.
Honorable President, Madam Director General, distinguished delegates, I'm delighted to stand here today again. This place where my father, the late Ihsan Dogramji, stood so many times. I am here thanks to the fact that he established a foundation within WHO to reward people who have given outstanding service to health and in particular family health. Ihsan Dogramji was a pediatrician and an educator, a lifelong supporter of the World Health Organization. When he died 6 years ago, he was the last of the original signatories of the WHO Constitution back in 1946. Over the course of his long career, besides his work in child health, he was active in promoting university education and especially medical education. In Turkey, he established a medical school which evolved into a leading university. He established a second university, the first non-profit, privately funded institution of higher education in Turkey. And meanwhile, he was serving on WHO panels and traveling around the world on WHO missions to advise new medical schools in places as far-flung as Nigeria, Brazil, Cameroon, and Canada. For a quarter of a century, he, the first president, and then Director General of the International Pediatric Association. So I have the privilege to be presenting the İhsan Doğramacı Family Health Foundation Prize for the third time since he passed away. The prize goes this year to an outstanding physician, Professor of Epidemiology and Public Health, Sir Michael Marmot, who richly deserves this recognition. His contributions to our understanding of health inequalities, especially in family health, and especially in maternal and child health, have improved the lives of thousands of mothers and children, and consequently of families around the world. Professor Marmot has concentrated on major themes to reduce health inequities. He advocates for equity from the start of life and for the empowerment of women through education and social action. His recent book, The Health Gap, brings together the evidence to convince governments and international bodies to take these themes to heart in formulating health and education policy. And you at WHO, of course, know his leadership in producing the 2008 report, Closing the Gap in a Generation, followed by the English Marmot Review, published as Fair Society, Healthy Lives, and the European Review of Social Determinants and the Health Divide. These are all the more pertinent when we consider the millions of refugees around the world, as in my own country, Turkey, many of them children. The condition of these refugees is opening the gaps ever wider. I know my father would be proud, as I am, to see his prize awarded to Professor Marmot. Thank you.
Later. We go down. Yeah.
İhsan Doğramacı was a remarkable man who made fundamental contributions to child health and to education. A pediatrician, he transformed medical education and then higher education in Turkey. For these reasons, it makes it a particular pleasure for me to accept this award. Much of my research had been on inequalities in health in middle and older ages, but when I came to chair the WHO Commission on Social Determinants of Health, I became utterly convinced by the evidence on the importance of good early child development to adult health inequalities. Arguably, the single biggest reason for the decline in infant and child mortality globally has been education of women. Empower women through education, and there will be improvements in women's health, the health of their children, women's control of their reproduction and sexuality. This reduction in child mortality is greatly to be welcomed, but for every child that dies, there are perhaps 25 who have less than flourishing early child development, by which I mean psychological, social and emotional, and behavioral development. We see a life cycle acting through the family. A flourishing child is more likely to become an educated adult. An educated adult is more likely to provide the conditions for children to flourish. Health at every stage of the life course will be improved and health equity enhanced. But all of this is strongly influenced by socioeconomic circumstances. There is a social gradient in early child development, as there is in adult health. The better the socioeconomic position, the better the early child development, and the better the health at every stage of the life course. Improving family health requires action on the social determinants of health to create the conditions for families to lead flourishing lives and enjoy the good health that should be everyone's human right. If in awarding and my accepting this prize, that helps to further the cause of health equity, of social justice and health, then I'm doubly delighted. Thank you.
Shukran, Professor Sir Michael. I thought I'll just clarify one point before I continue in Arabic. Please don't think that over the last 4 days I've developed a stutter or speech impairment when I'm speaking in Arabic, but I'm listening to Margaret's ear with translation and I have to follow her. It's very slow. So I'll continue in Arabic now, and just to explain that I'm still normal. وإنه من دواعي سروري أيضا أن أعلن الآن أن جائزة.
Ladies and gentlemen, it is now my pleasure to announce that the 2016 Sasakawa Health Prize has been awarded to the Federation of Medicus Mundi, Spain, represented by its president, Dr. Eduardo Garcia Langarica. I invite Mr. Yohei Sasakawa, WHO Goodwill Ambassador for Leprosy Elimination and Chairman of the Nippon Foundation, to address the Assembly on behalf of the Sasakawa Memorial Health Foundation. Sir, you have the floor.
President of Assembly, Dr. Ahmed Mohammed Al-Saidi, Director General, Dr. Margaret Chan, Honorable Ministers, distinguished guests, ladies and gentlemen, good morning. Let me begin by congratulating the Federation of Medicus Mundi, Spain, for receiving the 32nd Sasakawa Health Prize. I would also like to thank the Sasakawa Health Prize selection panel for your understanding of the objectives of this prize and your careful consideration in selecting this year's recipient. The Nippon Foundation established the Sasakawa Health Prize in 1984 when WHO was promoting the Health for All initiative under the Declaration of Alma Mater. The objective of this prize is to recognize individuals and organizations who have made a positive impact on people's lives and an outstanding contribution to the field of primary health care. The prize also aims to encourage the further progress of their activities. This year, Medicus Mundi Spain is awarded the prize is recognition for their project seeking the, quote, transformation of public health systems based on the principles of primary health care, end quote, in El Salvador, Guatemala, Peru, and Bolivia. For more than 20 years, this project has aimed to improve access to primary health care in rural areas and indigenous communities. I hear that local participation, that is, working with health workers, therapists, administrators, and residents in each community, is central to this project. Medicus Mundi Spain will use the award funds to conduct scientific research on the impact of the project on the health systems of the 4 countries. They also plan to study the possibility of implementing the project in other regions. We hope that their work will make a further contribution to improving primary health care. Now, all of us are working towards sustainable development goals, one of which is ensuring healthy lives and promoting well-being for all at all ages. Together with Medicus Mundi Spain and everyone here today, let us continue in our effort to achieve this goal. Congratulations again to Medicus Mundi Spain.
شكرا ويشرفني أن أقدم هذه الجائزة إلى الاتحاد الأسباني.
Thank you. It is my privilege to present this prize to the Federation of Medicus Mundi Spain. Ladies and gentlemen, distinguished authorities, first and foremost, I would like to thank the World Health Organization and the Selection Committee for the Sasakawa Health Prize, Mr. Sasakawa, and the foundation that he leads for awarding this prize to Medicus Mundi Spain. I would like to express our thanks to the Ministry of Health, Social Services and Equality of Spain and all the people who work in this ministry and who have worked to submit this proposal. I would also like to thank the Minister of El Salvador, the Minister of Peru, and all the institutions of the plurinational states of Bolivia, Guatemala, Peru, and El Salvador who we work with. Every day, they have supported this proposal through their work. Finally, I would like to recognize and thank teams working on the ground for their dedication and their quality. They are an essential part of the ideological vision of Medicus Mundi, so I thank them for that today. This prize is a recognition of the contribution made by Medicus Mundi in defense of the right to health and in achieving a transformation of public health systems based on the principles of primary healthcare. The project is part of the model of integrated and inclusive health, which was conceived by Medicus Mundi for primary level care. It's been underway in Guatemala, Bolivia, Peru, and El Salvador for more than 2 decades. It's achieved an improvement in healthcare coverage and equitable access to healthcare for rural and indigenous communities. We prize this award above all others. In our work, often we work with communities. This recognition shows that these communities are not alone and that what we're doing is being recognized by all and that nobody is being left behind. Thank you very much.
شكرا لك.
Thank you. It is now my pleasure to announce that the 2016 United Arab Emirates Health Foundation Prize has been awarded to Dr. Police Mohammed of China. I invite His Excellency Ambassador Obaid Salem Saeed Al-Zabi, Permanent Representative of the United Arab Emirates to the United Nations, to address the Assembly on behalf of the United Arab Emirates Health Foundation. So you have the floor.
معالي الدكتور أحمد بن محمد السعيدي رئيس الجمعية العامة لمنظمة الصحة العالمية.
Excellency Dr. Ahmed bin Said, Chair of the WHO Assembly, Madam Dr. Chan, Director General of WHO, Excellencies, Ministers, representatives of health ministries in particular, ladies and gentlemen. Speaking on behalf of the United Arab Emirates Health Foundation, I'm delighted to extend greetings to you here at this annual ceremony, this annual awards ceremony, which seeks to reward organizations and individuals that have made a major contribution to improving the health situation throughout the world and thereby improving the state of humankind in general. Thanks are due to all members of the WHO Executive Board. I'd like to thank them for all of the preparatory work they have done in ensuring that these awards can indeed be bestowed once again this year. We know how important WHO is. That is very much recognized by the UAE and indeed by the international community in general. And the awards that are given are a way of encouraging people to do more in seeking to serve the cause of improving humankind in general, improving our world without distinction based on race, gender, age, or religion. The award from the United Arab Emirates Health Foundation has made a contribution to major work that is undertaken in many countries, and a lot of charities have been supported. Indeed, we were established in 1969, and since then 45 different organizations, NGOs or bodies have been recognized and have obtained awards. I'm delighted then to give the award this year to Dr. Police Mohammed from China. We know that she works in Xinjiang province and she's been working there for more than 30 years. She is a tireless worker for public health promotion and fighting against outbreaks of disease and epidemics in that part of the world. And Dr. Police Mohammed has made a significant contribution to disseminating good practice for breastfeeding, for instance, and also water purification and sanitation. All of this has significantly improved the health situation in rural communities in Xinjiang province, and we've seen that particularly over the past decade. Further, Dr. Police Mohammed has headed many research projects, and in particular, child nutrition has been studied in poor rural areas, focusing on children under 6. That particular research project was focused on ensuring that children could get 1 meal a day, and indeed more than 200,000 children were able to get meals free of charge thanks to that project. It was undertaken in 8 poor rural areas, including the Xinjiang province. So I'm really delighted now to hand over this award to Dr. Mohammed. We are sure that she will continue to cooperate with the Health Ministry in China, seeking to improve child nutrition in particular in poor rural areas. and we wish to recognize what she's already done in that area. But let me emphasize that this award is always intended to encourage researchers and scientists to do more, to meet the challenges that we face in our world today, so that we can achieve more in future. We can be more creative, be more innovative in facing the health challenges that are out there. I would like to conclude then by expressing once again my appreciation of the work done by Dr. Mohammed. I pay tribute to you, Madam, and I would like to emphasize that we are determined to continue to do our utmost to improve health for all. May the peace of God be upon all of you at this time, and His blessings remain with you. Thank you. I am now delighted to give this award to Dr. Police Mohammed from China.
Honorable Mr. President, ladies and gentlemen, to implement the global strategy on health for all, the Chinese government attaches great importance to increasing investment to expand primary health care. These efforts have been effective and successful. In the Xinjiang Autonomous Region, which expands to 1/6 of China's territory, 5,300 doctors in public health institutions spare no efforts to improve the health of the 20 million people from all ethnic backgrounds living in the region. To seek actively and apply with success low-cost, popular and wide-ranging health promotion methods to advocate healthy lifestyles and promote their adoption by the people. And they use as much as possible local food to achieve a healthy and balanced diet and good nutrition. They have achieved outstanding results in preventing malnutrition among the poor and marginalized people living in ethnic minority regions. At this podium, I'm very honored to be awarded the 2016 UAE Health Foundation Prize. It's a recognition of the efforts of all the doctors working hard to improve public health. It will further encourage us to join efforts to achieve WHO's noble mission to help everyone achieve the highest possible health standards. I take this opportunity to thank China's Ministry of Health, thank my colleagues, and I would also to thank my bosses who over the years have supported me in my efforts. I also thank my predecessors in the public nutrition community in China. Your professionalism, dedication, and sense of historic responsibility is always a source of inspiration for me. You deserve this award more than me. My special thanks also go to my husband, my family, and my friends. Your love empowered me. And thanks to you, I've been able to make disease prevention and serving the people my belief and my lifelong cause. I also thank the UAE Foundation. Thank you.
شكرا جزيلا. وإنه من دواعي سروري أن أعلن إن
Thank you. It is now my pleasure to announce that the 2016 His Highness Sheikh Sabah Al-Ahmed Al-Jabbar Al-Sabah Prize has been awarded to Dr. Michal Novak of Slovakia. I therefore invite the State of Kuwait Health Minister, Dr. Ali Saad Al-Obaidi, to address the Assembly on behalf of the State of Kuwait Health Promotion Foundation. You have the floor.
معالي الدكتور أحمد السعيدي رئيس الدورة 69 لجمعية الصحة العالمية. معالي الدكتورة
President of the WHA, Margaret Chan, Director General of WHO, Excellencies, Ministers, ladies and gentlemen, ambassadors, heads of delegation, ladies and gentlemen, good morning to you all. I am delighted to be here with you this morning at this event organized under the auspices of WHO to bestow the prize, the award that is going to be given today from the State of Kuwait. And this is the His Highness Sheikh Sabah Al Ahmad Al Jabbar Al Sabah Prize for research in healthcare for the elderly. And the award today is going to be given to Dr. Michal Novak of Slovakia. This award recognizes his research into treatment for Alzheimer's disease. This award is named after a prince from Kuwait, and it reflects the view of the state of Kuwait. It reflects our country's commitment to ensure that older persons are able to enjoy appropriate health care, and we seek to encourage health research to that end. Of course, our overriding objective is to ensure that older persons can enjoy a better life, because we recognize the contribution that they can make to society. I would like to take this opportunity of saying how proud we are of WHO, how much we appreciate the efforts it makes and the leadership shown by WHO in seeking to ensure health, security and safety for all of us. We are convinced that WHO can lead us forward towards achievement of the Sustainable Development Goals. And we note that health is really a driver for development, as is recognized within those SDGs. Today, then, this award is being given in recognition of work done for healthcare for the elderly. And the fact that I'm here to give this award reminds us all of the importance of the strategy that we have for promoting health throughout the life course to ensure that people can live healthy lives at all stages in their life. And this is very important because we live today in a world where we are all striving for peace, justice, dignity and equality. And health promotion throughout the life course has to be a crucial part of that. I would like to commend the person who is now about to receive this prize, Dr. Michal Novak, and he is from Slovakia, and I certainly wish to commend the work that he has done. I conclude by wishing all of you good health and by reiterating our commitment to work together with others, led by WHO as we move forward. And I would like to recall how proud we are to be part of the WHO as we seek to achieve health goals in the broadest possible sense of the word, as we seek to ensure that we can all enjoy health and well-being within the context of the SDGs. And I wish to underscore the importance of the 2030 Sustainable Development Agenda in that regard. I wish you all the peace and blessings of God.
يشرفني أن أقدم هذه الجائزة للدكتور مايكل نوفاك من سلوفاكيا.
Thank you. It is now a great honor for me to present this prize to Dr. Michal Novak of Slovakia.
Your Excellency, Mr. Chairman, Madam Dr. Margaret Chan, Director General, ladies and gentlemen, dear friends. I would like to express my deep appreciation and humble thanks for awarding me this prestigious prize. Simultaneously, I would like to extend my sincere gratitude to my wife Maria and my beloved children for supporting me for more than 30 years when I was working on tau protein hypothesis of Alzheimer's disease, and I was determined to discover the secrets of this dreadful disease. Alois Alzheimer, 110 years ago, first discovered dementia form, special one, which was later named after him as Alzheimer's disease. And Alois Alzheimer's legacy is that we left us with the flame-like structures he described in the patient Augusta Day, which he called them tangles. For 80 years, researchers were walking around these tangles, but there was no tool which would allow them to open the mystery of tangle. They had to wait until 80s of last century when great molecular biology took place in the world. I was lucky to be part of that wave, and I developed new technique of so-called Neuro Immuno Imprinting, where I was able to take imprints in the brain from disease structures. This technique allowed me to say what is the structure, and that way I have discovered that tangles, which Alois Alzheimer described, were made of protein tau. And it was in 1988 where I presented this result in Las Vegas. It's the first international conference on Alzheimer's disease in Las Vegas, telling the world, this is a culprit. This is a potential drug target. At that time, I called it a hypothesis of tau protein for Alzheimer's disease. As I mentioned this technique, it wasn't enough to have a tau protein. Then we realized that this protein is important for transport in the brain. In the brain, which consists at least from 150 billion neurons, which are interconnected with 3 trillion synapses, communication points, which are not static. They walk from one place to the other, monitoring environment and doing all job what is such a brain, which is under absolute control of our body, should do. Yes, we knew that it is a tau, but it took me another 5 years to discover what happened to that tau. And then we realized that part of that was cut off, and he changed completely his nature, disturbed communication in the brain, and especially synapses. When the synapses damage, then comes what we see in Alzheimer's disease, loss of memory, and many other cognitive impairments. So I could say that at that point, we understood language which would allow me to decode Alzheimer's disease. Since I was able to read what happened in molecular terms, so I suddenly realized I have a language identical with Alzheimer's disease. Breaking the code of Alzheimer's disease was a major achievement because it is the most aggressive part of tau protein which is able to pull out all healthy servants tau proteins and to build them into the deadly structures and depriving us of our memory. I was incredibly happy when I could design a vaccine, disease-modifying vaccine, because by that we knew that every 8 seconds later, 4 seconds, and currently 3 seconds, new cases of dementia occur. And it was clear to me that we have to work harder. There is no time to lose. And I was setting up the vaccine which was able to target disease tau protein and keeping healthy tau untouched. In other words, removing disease and yet leaving the functional part of the brain to go on and to work and to improve. That was a major step. First obstacle was first clinical phase in human. Why? Everybody was afraid to go and inject the first patient because previous vaccine failed and there were a few people dead. But eventually, studying our results and research, vaccine took off. And first patient was injected in 2013. I am very glad to say to this honorable assembly that vaccine had no side effects. That was great victory over 244 clinical trials which had problems with the safety during last 10 years. So that was great hope. And now the vaccine is in second phase of clinical trials. Let us hope that work which led to this award is missing piece in therapeutic puzzle of Alzheimer's disease. Yes, let us hope. And I am sure that it will be so, that this is a missing piece in therapeutic. Cascade. And here I would end and thank you for your kind attention and the privilege to talk to you. Thank you very much indeed.
شكرا. وإنه من دواعي سروري أن أعلن.
Thank you very much indeed. It is now my pleasure to announce that the 2016 Dr. Lee Jong-wook Memorial Prize for Public Health has been awarded to Dr. Alireza Mestaghina of the Islamic Republic of Iran. I therefore invite Mr. In Song Kim, Secretary General of the Korea Foundation for International Healthcare, to address the Assembly on behalf of the Dr. Lee Jong-wook Memorial Fund.
Excellencies, distinguished delegates, honored laureates, President and Director General Margaret Chan, and ladies and gentlemen, as the Secretary General of Korea Foundation for International Healthcare, COFI, it's my great honor to present Dr. Lee Jong-wook Memorial Prize for Public Health. Until this year, the prize conferred 9 honor laureates, including 7 institutions and 2 individuals. And I'd like to pass my congratulations to Dr. Alireza Mestaghina from the Tehran University of Medical Science as today's dignified laureate. My sincere gratitude goes to the WHO and the delegations from all over the world for your unwavering support to ensure that the prize has become a prestigious award in 10 short years. Only a few decades ago, we never expected to become a member of an OECD Development Assistance Committee, but this miracle was achieved with the hands of the international communities as well as our own effort. In order to help creating other miracles in partner countries, COFI was established in 2006 under the Ministry of Health and Welfare of Korea with the philosophy of the late Dr. Lee. His legacy paved the way for Dr. Lee Jong-wook Fellowship Program, which is a sponsored invitational training course for health professionals abroad. Now the fellowship program has 526 alumni from 28 countries and enables them to promote Sustainable Development Goals in their own countries. In accordance with the new shift to SDGs, the President of the Republic of Korea already assured last year to provide what we call Korea Aid with the amount of $2.1 billion. Our foundation, as it has always been, will continue our efforts to make a healthier world for all. Once again, I would like to congratulate this year's laureate, Dr. Alireza Mastaghini from Iran, for his lifelong devotion to improve the public health of Iran. Thank you. 감사합니다.
Bismillah ar-Rahman ar-Rahim. Mr. President, Madam Director General, distinguished ministers, guests, and delegates, ladies and gentlemen. On behalf of the large public health family in Iran, it is my pleasure, my utmost honor and pleasure, to receive the prestigious Dr. Lee Jung-wook Memorial Prize for Public Health in 2016. This award belongs, I believe, to almost 4 decades of continuous contribution to public health improvement in making a better and healthier country and the world. I am also very fortunate that I received this award on the occasion of the 50th anniversary of the School of Public Health at Tehran University of Medical Sciences, SPH, where I had a privilege to be the dean for 28 years, is the National Center of Excellence for Public Health Education. While I am wholeheartedly grateful to Professor Ali Jafarian, the Honorable Chancellor of TUMS, for his support and presence in this ceremony, I would like to commend my colleagues, faculty members, students, and staff at SPH. Without their endless efforts, we could not have contributed to elimination of malaria, establishment of primary health care, training more than 8,000 experts, running 15 doctoral and 17 master's programs, and several thousands of scientific publications in Iran, among numerous achievements of the SPH. I am also thankful to His Excellency Dr. Hassan Hashemi, the Minister and officials at the Ministry of Health and Medical Education for nominating me for Dr. Lee Prize, and the WHO Selection Committee and COFI for selecting me as the recipient of the award in 2016. As the citizens of planet have just begun to implementation of UN Sustainable Development Goals to build healthier and more prosperous living for all at all ages, as a small token of contribution, I am pleased to devote most of my financial award to sustainable health development agenda at the SPH, Iran, and globally. I sincerely wish that this small endeavor may contribute to transforming our world and a better future for every human being to reach sustainability in improving global health. Thank you very much for your attention.